State University Extension, and I'm excited to introduce a new member of our Extension family here with me today. I have Maren Voss. Maren, will you just take a few minutes and introduce yourself? Kind of let us know what your background is and where you're from, things like that.
You bet. I have been at Utah State University in Extension for about 3.5 years, and I came to the Extension as health and wellness faculty. And I have a lot of training in different areas of the health sciences field. I actually have 4 graduate degrees because I really like education. I finished one of them just this last year, a second doctorate. And I call them all in the health sciences. I have psychology, occupational science, rehabilitation science, and then I have a master's degree in communication as well. But one of the beautiful things about being an extension as a professor is that I get to do community health programming at the same time as sort of trying to examine whether or not that programming is effective and do the sort of implementation science side of health education and health impacts. So that's what I've been doing. When I first joined in Extension, they asked the new health faculty to work on the opioid epidemic, since that was such a big problem in Utah. And so a lot of the programming I do is around trying to figure out how to provide more awareness and education and reduce the harms of overuse of opioids and some of the addiction issues that can lead to, along with overdose and death.
Right. And how has that been? I mean, it's a fairly new program with Extension. And a lot of new faculty brought on to work on that project. How has that been?
Yeah, so I think Utah State was sort of at the very front of Extension in general, of bringing more of a health focus. Extension has always done amazing things in the community, and they got into the health side of things with nutrition, and that kind of led to some physical activity health programming. But mental health, behavioral health, whole person health is a little bit new for Extension. And Utah State, when the opioid epidemic was starting to have a lot of impacts and there was starting to be a little bit of funding around that topic to try to reduce the harms, they decided we need to do more in Extension to address this issue. So they hired 5 faculty out at the same time to address the issue across the state. And it's been a great opportunity. So not only do we have all of those Extension contacts and community connections to work with, which is amazing. We have these other faculty that we can collaborate with, but there's also been a lot of funding and nationwide efforts to reduce the opioid harms. And so we've been able to do work in a lot of programs, a lot of areas. Every state has like consortiums and committees and task forces to address the opioid epidemic. And so we're members of those at the state level, to the county level, as well as at local city level coalitions. We're able to, like, one of the things I like to do is try to support my local programs with extra funding. So I've been able to write for some grant dollars that we can then sort of disperse to some of our local coalitions and agencies for some of the work that they're doing. So there's been a lot of opportunity, and I think that we're really having some impacts. It's kind of hard to tell. A lot of times you do awareness raising, but you don't know if that actually turns into a change in people's health. But we've done some things, like recently we worked with partners to provide some extra medication for addiction treatment resources that weren't available in our county previously. And that collaboration probably wouldn't have happened without USU joining the efforts of the local community. And we were also able to do some things with the jails. The jails were already knowing that they needed to address the issue. When inmates leave incarceration, they have like 8 times the risk of overdose of the general population. And that's partly because if they are a person who's been using any opioids, either prescription or illicit, they tend to detox while they're in jail. But if they go out and leave and they use at the same level they had previously, they're much more likely to overdose and die from that. And so we've been able to work with the jails and get them access to naloxone that they're able to give to every person as they leave incarceration, as well as a little bit more information around the safety and risks. And so So there have been some really great opportunities for partnerships like that I think are probably going to have real health impacts in the area.
Yeah, that's great. Um, Talk a little bit about how you ended up at Extension. Were you familiar with Extension services before, I know you said you've been here for about 3 years.
Yeah, not at all. I like to talk about developing my love for extension. Sort of, it's not coerced, but very indirectly. I have a picture of my brother taking care of goats because we had goats, but I don't think I ever touched a goat when I was growing up. I was not a person that got into nature and agriculture and anything like that. Never did 4-H, anything along those lines. So I did not know about extension prior to seeing a job posting in health extension. Um, and I always stayed sort of on the bookish academic side of things. And I did not even realize when I took the position how community implementation focused it was. So I kind of jumped in just thinking that we were going to be doing health education and trying to have an impact on health in the community. And showed up at coalition meetings, started talking to the prevention teams and partners, and it's just been amazing to see, just to be part of that community-wide effort.
Yeah.
And rather than a lot of times faculty are just up in they call it the Ivy Tower, up on main campus, just talking to students, doing, thinking that I'm impacting the next generation because I'm imparting knowledge to these students who are going to go out and impact the world. But health extension, we are out in the community with everyone, and it's really been an amazing opportunity.
Oh, that's great. Yeah, I find most faculty I talk to, they're either, born and bred extension, did 4-H as kids, or they had no idea what extension did until they accepted the position. So I think that's kind of a fun thing to learn about each individual faculty member. Do you want to talk about any of the specific programming that you've participated in or developed in your time with extension?
Yeah, you bet. Although I will just come back to the born and bred extension or being a transplant, but I'm a total devotee now. I am constantly pitching to people how great extension is, because they are, they know the sheriff, they know the local health department officials. Like, if you want to have impacts in any area, extension is the way to go. It's amazing programming, amazing services.
Yeah.
And actually, that brings me to one of the programs that I've developed by jumping into these coalitions, talking to the community members. We started with, they call it a needs assessment. It's the idea that from academia, I don't really know what your local community need is. So I need to talk to the people who are in the day-to-day on the ground, figure out what's going on, to figure out where the needs are. So we started that. And one of the things I heard was that there was this great type of new behavioral health treatment professional called a peer support specialist. And that person, they're called a paraprofessional because they don't have a graduate degree and they don't have like a clinical licensure, but they have something that is sometimes considered better. They have life experience in the field of addiction or mental health issues. And so then an individual who has that life experience, if they've been in recovery and they've been doing well for a period of time, they can apply to get to take a training and get credentialed as a certified peer support specialist. So they learn things during that time about ethics and appropriate boundaries. They learn things about how to tell their story and integrate their own experience in a way that's helpful and positive for the people they're working with. So it's not just about them dumping their story on the world, but it's about, how does my story help motivate and encourage you? So they learn some skills around how to incorporate their experience into encouraging others to instill hope. They learn some skills that are called motivational interviewing. I don't know if you've heard about that, but it's the idea of, people are only going to be able to change from where they're at, and you can't force people to change. And so it's a sort of therapeutic approach of understanding where a person is and then asking the kind of questions that are going to sort of lead them along rather than to push them toward change. And I think a lot of times in public health, we try to push people toward change. And so these people learn skills about how to sort of coach and lead and encourage in a way that's really effective. So they learn all these skills, and then they become treatment professionals along with the licensed clinical social worker, the psychiatrist. There's just a lot of benefits to having someone who's had lived experience on the treatment team.
Yeah.
You get some different perspectives. People feel understood. They see an example of a person who's been successful in recovery, and so they feel hope from that. So there's a lot of benefits around that. But as I was in the community, I heard people talking about this great new approach, but I also heard that it was really hard for a person who'd been through this really hard life experience. Maybe they'd had incarceration, their ability to go to college or get a job had been disrupted.
Yeah.
And so these are people who tend to have lower wage jobs. They're just getting back on their feet. And for them to take a week off to go do this training, to pay for a hotel, like that, a lot of times it was just not accessible. It was hard to go and get this training. We have some grant funding, and the states had this funding so that we can make it so that they don't have to pay for the training itself, but all the other costs, taking time off work, was just too much. So after talking to the community members about that need, they had the idea that if it could be online, perhaps it would be more accessible, especially with Utah being such a rural state.
Yeah.
But the state wants people to have a really high quality training experience too. So we worked with them and developed a hybrid version where they can attend like 3 days of the training can be through the online curriculum, and then they can go just to a 2-day. It can be on a weekend where they don't have to take time off work, and they can go and get this training and this certification and then bring that skill set back to support the treatment workforce in their area. So it's a certified peer support specialist training program that we developed. And we initially developed that program, and then we were able to get some federal funding to expand it. So over the course of 4 years, we should be able to train an extra 360 of these professionals and get them out into the workforce in Utah. So it's kind of exciting opportunity.
So this is, after they receive this training and certification, it's a potential a potential job opportunity, right?
Oh, absolutely. So there's two parts of that. One of the beautiful things about the certified peer support specialist workforce in Utah was sort of at the forefront of this is that it's an approved Medicaid provider. So as long as they're getting supervision from a clinical worker, they can be a part of the clinical team, and the agency can bill Medicaid for the services they're providing. So it's very sustainable for the agency to employ a peer support specialist as part of their treatment team. So there should be jobs available, but at the same time, it's so new. People don't really know about it. This is a paraprofessional, which means that you don't have the same expectations as you would of somebody who's gone through, like I have 4 graduate degrees, right? So there's some different ways that the agency might need to work with the individual, give them time off at different times. They may have trouble with transportation, getting to work if, there's some ways in which the agency might want to do a little bit of extra help and support to keep this valuable part of their workforce. There's a little bit more job turnover because it's a lower paying job. So it can be hard sometimes to incorporate these specialists in the treatment workforce, but at the same time, it's just so beneficial for the clients. They just have better treatment outcomes. And it's great jobs for people who are on their recovery journey. At the same time, it's a win-win because they're helping people through recovery, and at the same time, their own recovery is being strengthened.
Right. Well, and it takes something that could have such a negative impact on their job prospects, like past experience of addiction, you mentioned incarceration, and turns it into a strength and something that qualifies them to help other people and qualifies them uniquely for this kind of new position. That's amazing. That's so great.
We were trying to work with a group to bring peer specialists into a hospital setting, and there's moms who've had opioid use disorder will sometimes have a baby that has fetal exposure, and that sometimes they call it neonatal absence syndrome if it's severe enough, or sometimes it's just fetal exposure where they've been exposed to the substance and their body isn't quite functioning at the way it should. So the hospital will know when there's been this fetal exposure from testing the baby's blood. So a mom in that situation might get referred to Division of Child and Family Services for welfare checks and that sort of thing. That can be a really scary time, right? Because they're afraid their baby's going to be taken away from them. Maybe they've been going through withdrawals. They might be worried about, if I use opioids, is that going to impact my breast milk? There's like all of this uncertainty and scariness around that. But a lot of times they don't trust the state officials to be on their side. And so having a peer, someone who's been through some of these difficult recovery experiences themselves, that can be part of that treatment team, that can be reassuring to the mom, you're going to get much more engagement. And then that baby's going to have a better experience. They're going to be safer, fewer risks at their home, because the parents engaging with the treatment professionals, rather than feeling like they're, have to guard against the treatment because of fear of taking the baby away or whatever it is. So that's just another place where a peer could be helpful and useful. And you're right, their experience then becomes a strength in that scenario.
So you sent me some links. Tell folks about where they can learn more about this. And while you're talking, I'll find those links and I'll put them in the comments.
You bet. So Utah was one of the early states to certify peer support specialists. And so this is the Division of the Department of Substance Abuse and Mental Health. Anyway, one of our departments at the state level in Utah runs that certification. And so it's a one-stop shop for finding out about how to become a peer support specialist. And so when you access that application site, they have a little bit of information about the training and the programs, but there's just one little click for getting an application to apply. It's one page. You fill in some of your basic information. They ask you to tell them about your recovery story. And then people also at the same time submit 2 letters of reference with that. But it's a very simple application process. The state right now does have funding for all of the trainings, but they're offering them about every other month. Sometimes they'll be 3 months before the next training. We also, through some federal funding, once a person gets the initial training, we have a way to help support them if they don't already have a job as a peer support specialist, with some practicum stipends, and then down the road an apprenticeship in the field. There's some workforce development training opportunities and some funding for people as well who want to.
That's great. I was wondering about that because you were saying it's a relatively new thing, and sometimes there are barriers that employers have to be aware of. So that's great that there's follow up on the other end once they've received that training to help them, find employment and things like that.
Yeah, and it may be, especially out in our more rural areas. We have our local mental health authorities, and they have agencies in some of the bigger cities out in the rural areas. But then there's so many other cities like Blanding or other areas of the state where there may not be a mental health treatment agency that has enough capacity to hire another employee.
Yeah.
And so in those situations, individuals can work a little bit more on a volunteer basis, but because of these stipends we have for that practicum period, as long as we can find someone to supervise them, they could be starting groups. There's a group called Addicts to Athletes. They could start a charter group of one of those and be coaching and working with peers and people in recovery. They could be doing mental health, like a NAMI group. And starting a group there and supporting families and people with mental health and illness issues. So there'd be ways for them to volunteer and yet still, through this stipend funding, be supported in that. And then who knows, after a year of that sort of extra experience and training, then they're so valuable in the community, then it creates a new job for themselves. So that's sort of what we're hoping happens as more of these jobs open up.
Yeah, that's great. And I feel like those are folks who are watching, maybe, this is not an opportunity that, would work for you, but how many of us know people in our network or in our community that could benefit from something like this? So I just think it's a really good thing to be aware of and to know about.
Yeah. Although you would be surprised how many people are not talking about their substance use issues or their mental health issues. And yet, it's been a part of their life or their family member's life. And so I think reducing the stigma so people feel like they can talk about it is helpful. But there may be people who's like, I've had that struggle, and I've still maintained my job and my work and my family life, but I want to help other people, and this is a perfect opportunity to get some specialized training and then go and volunteer and help reduce the stigma and support people so that our whole society is healthier.
Yeah. Oh, that's fantastic. Well, I put the link to, you said it was the Department of DSAMH.
Yeah. Is it department or division? I can't remember. Substance abuse and mental health.
Yeah. So that link is in the comments for folks who are interested or who maybe want to share this program with people they know who may be interested in that. That's fantastic. I think that's a really good note to end on, Maren. This has been so great to get to learn a little bit more about you and your background and the programming that you're working on. I appreciate it so much, and I hope that you'll come back and maybe we can dig into some more public health topics. I mean, I don't think I've talked to anyone more qualified than you with 4 graduate degrees, so I would love to have you come back for another conversation.
That sounds great. Thanks so much, Marta.
All right. Thanks for watching, everyone. And I hope you have a great weekend. We'll see you next time.